Good morning, everyone. Thanks for joining us today. I am Matt Greco. I am the events manager here at PSS Life University. And today we are very lucky and happy to have the Hospital for Special Surgery with us, and in particular, Randy Rodriguez, who's going to talk about some of the intricacies of Medicare. And we also have Nadia Murphy, who's going to be assisting him. And Nadia is a social worker at the hospital. Randy is a program manager for the Voices Medicaid Education Program at the Hospital for Special Surgery. His background includes experience working at a local Medicaid office in upstate New York and a Medicaid managed care plan, and over 10 years with HSS. In his current role, he leads several of the hospital's efforts to support Medicaid patients across HSS and its regional sites, with a focus on expanding access to musculoskeletal care and improving insurance literacy, especially for aging and dual eligible populations. Randy's dedication to healthcare advocacy, combined with his hands-on experience in both direct services and managed care, enables him to effectively understand and address the challenges faced by Medicaid recipients. And with that, I'm going to hand it over to Randy. If you have questions, just put them in the chat and they'll be managed as we go along.
Excellent. Thank you. Thank you. I'm glad to be here. And I hope that the information that I provide, you'll find it useful. So I'm going to share my screen. I do have some slides, and some slides I'll go over quicker than others, but there'll be opportunities for questions, and then also some slides will we'll spend a little bit more time. Hoping everyone can see my screen. Nadia, can you confirm that? Great, excellent, thank you. So the purpose of today's presentation is to talk about how to navigate Medicare, understanding your benefits and options. And part of the agenda for today will include discussions about Medicare open enrollment periods, the ABCs and Ds of Medicare, what a lot of people call the Medicare alphabet soup, Medicare versus Medicare Advantage, key differences and considerations between the two, and then talk about dual eligibles, individuals who have Medicare and Medicaid, and information on how to navigate benefits for those that do have both coverage. Okay, so a little bit about the Voices Medicaid Education Program. We are part of the hospital's social work programs department. We provide support and assistance for individuals who have Medicaid, and then also those who have Medicare or Medicare and Medicaid coverage. And part of our responsibilities is because is really due to the fact that public insurance, Medicaid, or Medicare can be overwhelming, even if you are well informed and understand how the coverage works. So when it comes to Medicare, choosing the right Medicare plan is no small task, especially if you're managing a unique or complex medical condition. And finding the best fit depends on factors like your age, your eligibility, and whether you have other health coverage options. So here at Voices Medicaid, we provide education for patients and community, um, and wanting to maintain access to care and to world-class musculoskeletal care at the hospital. So going to pause there, I see a question in the chat. Nadia, can you read the question for me, please?
Yeah, it's about making the slides bigger.
Let's see.
We're putting it in slide view. I'm not sure if that's an option.
Let's see. That better?
Yeah, that's better.
Yeah.
Okay, excellent. All right. All right. So like I was saying, the program helps community members seeking care, musculoskeletal care at HSS. We help individuals navigate their coverage, so that they can access care at the hospital. And some of the ways that we help patients do this is by assisting with questions on how to when it's time to transition from Medicaid to Medicare. We discuss Medicare open enrollment periods. We support with selecting a Medicare Advantage plan, which is important because sometimes when individuals may select a plan and changing to another plan may not be as simple as you may think. So it's always important to consider and discuss the best options for your healthcare needs. And we also discuss eligibility and benefits of programs to help pay Medicare premiums. And like I said, we know Medicare and insurance providers don't always address the specific evolving needs of people with ongoing health conditions, and it can make this navigating the system feel like another hurdle. So that's why the Voices Medicaid Education Program is here to give patients and community members the tools and guidance needed to feel confident and informed when making decisions about your health insurance and overall healthcare needs. Our goal is to make the Medicare process clearer, more manageable, which will support your health journey. So talk a little bit about Medicare. And this presentation today will be mostly basic information, some that you may already know, and some that is specific to some of the changes happening in 2025 for Medicare coverage. But I like to provide the basic information because even though individuals may be familiar with how health insurance works, there's some nuances sometimes that it's always helpful to reinforce the basic information, and then which helps individuals make sound decisions when it comes to selecting a specific Medicare plan coverage option. So we're going to be talking about the main parts for Medicare: Part A, hospital insurance; Part B, medical insurance, as well as Medicare supplemental insurance, which is also called Medigap; Medicare Advantage; Part D, and I'll also touch on Medicaid and other programs designed to help people with limited income and resources. To go right into it. Who's responsible for Medicare? Who oversees the Medicare program? Most people enroll in Medicare through Social Security, and the Center for Medicare and Medicaid Services, known as the acronyms are CMS, is the agency that sets Medicare policies. They determine benefits and oversee coverage, working closely with Social Security to make sure individuals get the care that they're entitled to. So who can get Medicare? Medicare is available for people who are 65 or older. Certain people under the age of 65 can get Medicare if they have disabilities covered under the Social Security disability insurance, and they've been on the insurance for at least 24 months, or people with of any age with end-stage renal disease or ALS. Those who immigrate to the United States can qualify if they have lawful status and have lived in the United States for at least 5 continuous years. And when it comes to Medicare resources, when you have Medicare, CMS will send them the Medicare and You handbook. They update it every year, and they usually send it around this time for individuals, Medicare beneficiaries, so that they can be familiar with the changes to the Medicare program for the upcoming year. The handbook explains Medicare and provides details on health and drug plans. Every household receives an updated copy, and can also find that information online. And to note, to get Medicare, you must be a citizen. I mentioned this already, but you must be a U.S. citizen or lawfully present in the United States for at least 5 continuous years.
There's
Um,
another
yeah,
question in the chat.
yeah, yes, I see it. Thank you, Nadia. Yes, so some cancers do qualify for fast track Social Security disability determinations. Those are specific to the stage, of course. But yes, it is possible to be approved for Social Security disability and get fast track for Medicare depending on the type of cancer and the stage that you have, that the person has. Okay, so moving ahead to the parts of Medicare. Medicare is broken up into three parts. Part A, which is your hospital insurance, which you mostly are going to think of situations where you're going to be inpatient. Part B is your medical insurance, which is what most people on Medicare use, your outpatient care. And Part D, your drug coverage, your medications. So Part A, like I mentioned, covers inpatient hospital stays, skilled nursing facility care, hospice, and limited home health services. Most people do not pay a premium if they or their spouse paid Medicare taxes while working. And Part A requires a deductible and coinsurance for hospital stays beyond 60 days. Your Part B medical insurance covers outpatient services, your doctor's visits, your preventative care, if you need durable medical equipment, and some home health care. It requires a monthly premium that gets deducted from your Social Security benefits. Most times you're not sending a check to Social Security, to Medicare. It just gets automatically deducted from your benefit. It includes an annual deductible and 20% coinsurance for most services after meeting that deductible. And then your Part D, prescription drug coverage, provides coverage for prescription medications through private insurance plans approved by Medicare. They involve a small monthly premium, a deductible, and co-payments for coinsurance for medications. It also includes a coverage gap called the donut hole, where out-of-pocket costs may increase until catastrophic coverage kicks in. But there is some information that I'll be sharing about that donut hole for 2025. Okay. So moving to the next slide. So I'm going to talk now a little bit about the different open enrollment periods, when to sign up and make changes to your coverage. So for individuals, enrollment is automatic if you get Social Security. And like I mentioned before, if you are under the age of 65 and have a disability and getting disability benefit for Social Security, you may also qualify for Medicare. You'll notice that I'm repeating some of the information, and the reason for that is because this is very foundational to the Medicare coverage. So it's very important to be familiar with these areas as you make your decisions. So for those who don't already have Medicare, generally the first opportunity to sign up for Medicare Part A or Part B is during your initial enrollment period, which is a 7-month period that begins 3 months before the month you turn 65. And it ends 3 months after the month you turn 65. Once this initial enrollment period is over, you may have a chance to sign up for Medicare during a special enrollment period. For example, if you didn't sign up for Part B during that initial period when you first became eligible, because you had maybe you had insurance through an employer, or your spouse. So those will be an opportunity. If you no longer have that coverage, you'll be eligible for a special enrollment period to select Part B. If you have to pay for Part A but don't sign up for it, or don't sign up for Part B during your initial enrollment period, and you don't qualify for the special enrollment period, you can also sign up through the general enrollment period, which is from January 1st to March 31st of every year. You may have to pay a higher Part A or Part B premium for late enrollment. And then for those that already have Medicare and want to make changes on how you get your coverage, you can join, switch, or drop your health or drug plan coverage during the open enrollment period, which is actually going on right now. This period starts every year from October 15th and ends December 7th. This gives you a full 7 weeks to compare and make decisions that help ensure that you'll have essential plan materials and membership cards in hand on January 1st when that new coverage starts. I want to also mention that if you choose not to make any change, then you'll just continue with what you have. It's not necessarily a recertification or renewal period. It's just that if you want to make changes, you can do so during that time. But for those that don't want to make any change, if you're happy with what you have, that will just continue in the new year. There is also the Medicare Advantage open enrollment period for individuals enrolled in Medicare Advantage plans, which we'll be discussing a little bit later in the presentation. There's also an open enrollment period for institutionalized individuals, or in certain circumstances during a special enrollment period. For example, if you lose group coverage throughout the year, or you lose your Medicaid coverage. Now, I want to mention here about the Medicare Advantage open enrollment period. We haven't talked about Medicare Advantage Medicare Advantage yet, but I will mention it here that this period, like I mentioned before, is from January 1st to March 31st of each year. Your coverage begins the first day of the month after you join this plan. You can only be you are only eligible for this enrollment period if you have a Medicare Advantage plan at that time. And during this period, you can switch to another Medicare Advantage plan with or without drug coverage. You can drop your Medicare Advantage plan and return to original Medicare. But if you do, you will have to join the Medicare drug plan, that Part D plan that I mentioned. Coverage begins the first of the month after you join that plan. Okay. So there was a lot of information that I've already shared. So just want to make sure that just to recap and also provide an opportunity for someone if they have any questions, now would be a good time to ask. But Medicare is a federal health insurance program for people 65 or older and certain younger people with disabilities and in specific conditions like end-stage renal disease. There are a number of open enrollment periods available throughout the year to make changes, and the one that's going on right now is your annual enrollment period. It's from October 15th to December 7th of each year. And then, as I mentioned, Medicare has a number of different alphabet parts. Your Part A, your Part B, your Part D, your Part C, also, which is Medicare Advantage. One thing to remember as I mentioned more of these different types of Medicare coverages, you'll notice that some of these parts have a number of a number of names. For example, Medicare is also, if you're not in the plan, is also known as traditional Medicare or original Medicare. A Part C plan is your Medicare Advantage plan, and so forth. Okay, Nadia, are there any questions?
No questions.
Okay, great. We'll move on. Okay, so to talk a little bit about what your Medicare options, what is available with original Medicare and then now introducing that Medicare Advantage, also known as Part C. So when you first sign up for Medicare and during certain times of the year, you get to choose how you get your Medicare coverage. Like I mentioned about throughout the enrollment periods. There are two main ways to get Medicare. The first one is through original Medicare, which gives you your Part A, your Part B. You can add a Part D plan, which will cover your prescriptions. You can also add what's known as supplemental coverage. This is your Medigap plans. These plans are designed to supplement a portion of the cost that Medicare doesn't cover, because original Medicare, if you're not in the Medicare Advantage plan, will only cover 80% of the costs of your care. In Medicare beneficiaries are responsible for that 20% that's not covered. So many end up selecting this supplemental coverage and pay a premium, and the insurance will cover that 20% as opposed to having to pay it out of pocket. And then with these Medicare Advantage plans, Medicare Advantage plans are a Medicare approved option from a private company like your Blue Cross Blue Shield, your United Healthcares, your Health First that offer an alternative to original Medicare for your health and drug coverage. All of the parts that I mentioned, Part A, Part B, and Part D, are all bundled into this one insurance plan option. And in many cases, you will be tied to a specific plan network, meaning that that insurance company that you go with will have a list of doctors that you can go to, and you will only have the option of going to these doctors if you're in that plan. In many cases, you may need approval to get from your plan before getting certain drugs and services, which is different to most of the care you get under original Medicare. Plans may have lower or higher out-of-pocket costs than original Medicare. You may also have an additional premium. And this premium that you pay for Medicare Advantage will be on top of what already is deducted from your Social Security benefit. Plans may offer some extra benefits that original Medicare doesn't cover, and I'll mention some here, but we'll go into a little bit more details. But like certain things like vision, hearing, and dental, very key services that original Medicare doesn't option. So these Medicare Advantage plans do provide that type of service, which is why many people end up selecting a Part C or Medicare Advantage plan. So going back to what's covered under Medicare. So Part B is your doctor services, your outpatient medical and surgical services and supplies, your clinical lab tests, your durable medical equipment like walkers and wheelchairs, diabetic testing equipment and supplies, preventative services like your flu shots and your yearly wellness visits, your home health care, medically necessary outpatient physical and occupational therapy and speech language pathology services, and outpatient mental health care services. So now we'll talk a little bit about what's not covered under Part A or Part B. Like I mentioned, the dental care, the vision for prescription glasses, your dentures if you need them, cosmetic surgery is not covered, massage therapy, and routine physical exams. So it's important to distinguish that a routine physical is not the same as an annual wellness check. So Medicare will cover an annual wellness check with your doctor, but it doesn't cover routine physical exams. And then lastly, they may be covered under a Medicare Advantage plan, which we'll discuss in a little bit more later. And then to talk about Medicare drug coverage, Part D. Part D is an optional benefit available to all people with Medicare. And while it is optional, it's a great benefit if you need help with your medication costs. If you choose original Medicare and want drug coverage, you'll need to sign up for one of these plans. It's not something that comes automatic as you register for Medicare. You do have to opt into getting a prescription drug plan. These plans usually come with a monthly premium and then offered by private companies that contract with Medicare. And the way to get Medicare Part D coverage is through a standalone Medicare drug plan, or like I mentioned, through a Medicare Advantage plan where everything is bundled and it'll cover your Part A, your Part B, and also your prescriptions. Now, it's important to know that when it comes to Part D, to your prescriptions, each plan and also Medicare itself has different tiers that determine the cost for that specific medication. These formularies must include a range of drugs in the prescribed categories and classes, and to offer lower costs, many plans place them in these tiers. Each plan can form its tier in its different ways. So that means that one plan may have, is there an extra fee if you don't get Part D? To answer that question, the fee would be that you would have to pay for your medications yourself. So so that would be primarily right out of pocket costs. So if you have a number of medications that you take, and you don't have a plan managing that benefit, then you will have a high out of pocket responsibility every month. Now, to talk a little bit about the different tiers, your tier one well, before I go there, I just wanted to just finish that each plan will have different formularies. So that means that the plans that, let's say, a Fidelis covers under tier one and tier two may not be the same plans that House First covers under that same tier. So it's always important before making a decision on specifically with a Medicare Advantage plan, it's always important to know whether the medications you take are covered under that plan. And the tiers ones and the tier twos are generally your generic drugs or preferred generic drugs, and they usually will be your least expensive. These drugs are the same as their brand name counterparts. They use the same active ingredients as brand name drugs, and generic drug makers must prove that the product performs the same way as the corresponding brand name drug. Your tier three, which does have a medium copayment, are your preferred brand name drugs, and they are going to cost more than your tier one and your tier two. Your tier four are your non-preferred drugs, and they obviously will cost more than your tier three. And then your tier five are your specialty tiers, unique to the type of condition that you have, and have the highest cost. In 2024, the contract year, the specialty tier threshold is around $950 for the full cost of a 30-day supply. And it's important to note that in some cases, if your drug is in a more expensive tier, and your prescriber thinks you need that drug instead of a similar drug on a less expensive tier, you can request an exception and ask your plan for a lower copayment. You can also request an exception to get a drug that isn't on the formulary by contacting the plan. Your plan may require a statement from your prescriber explaining why the drugs on the formulary don't meet your medical need. And it's also important to note that Medicare plans may change their formulary from year to year, which is why it's important to review your coverage each year, and take advantage of these open enrollment periods if you're finding that maybe you're paying more for your medications than you used to, and you realize that that's because they changed the tier, and you identify another plan that has it for a lower cost. So these are all things that throughout the year you should be taking note of, and reviewing your healthcare needs, and seeking out different options if you're finding that the one you have is not working for you. Okay. So now we're going to talk a little bit about Medicare Advantage plans, also known as Part C. And like I said previously, these Medicare Advantage plans do bundle your Part A, your Part B. It also most likely will include your Part D and some of those additional benefits. Is another way to get your Medicare coverage, and is provided by Medicare approved private companies. When you have a Medicare Advantage plan, when you go to your doctor's visits, you will present your card, and to receive the healthcare services and supplies that you need. Your Medicare Advantage Plan ID card is your main card for Medicare. So even though you have that Medicare red, white, and blue card, when you go to your doctors, or if you go to get an MRI, or if you need some type of equipment or medication, you need to show your plan card instead of your red, white, and blue Medicare card. However, you may also be asked to show that card, so it's always good to carry it as well. And just note that you should only be giving this information to your doctors, your pharmacists, and other healthcare providers, and those that you trust who work with Medicare on your behalf. Very important to keep that information secure. Okay. Now, there are a number of different types of Medicare Advantage plans. The first and most common one that people end up selecting are your health maintenance organization, your HMO plans. These HMO plans require members to use a network of designated healthcare providers and typically require referrals for specialist visits to ensure lower costs. We also have, there's also preferred provider organizations, PPO plans. PPO plans offer greater flexibility, allowing members to see both in-network and out-of-network providers without referrals through in-network care. But they are generally do carry a premium. So that's why some people may choose to an HMO over a PPO plan. But more as of the last couple of years, more and more insurance companies are offering PPO plans with low or no premium cost. So that's great because it does offer more flexibility than an HMO plan. There's also your special needs plans. These are usually for individuals that have Medicare as well as Medicaid, and they have specific needs such as chronic conditions. So these plans provide additional support for those Medicare beneficiaries. There's also your private fee-for-service plans. These plans allow members to receive care from any Medicare-approved provider who agrees to the plan's payment terms with more freedom in provider's choice. And then you also have your medical savings account plans. These plans combine a high deductible Medicare Advantage plan with a medical savings account where Medicare deposits funds that members can use for healthcare expenses. I'll pause there because I think I saw a question.
Yes. Do private insurers through Medicare Advantage have the right to reject treatments that your doctors advise?
Well, that's a really good question. For treatment that require prior approval, these organizations do have a medical review team led by a medical director that, based on the type of um, treatment or prescription that you need, they determine whether it's something that's medically necessary. So to answer the question, they do have the ability to deny care or suggest a different level of care based on a number of different review processes that have been established by CMS, and the plans have to agree to. Um, there are appeal processes if you don't if you don't agree with the decision. And there's also agencies that can help with those appeal processes, which I'll share at the end of this presentation. Because unfortunately, even though your doctor may say that you need some type of care, you need some type of medication, the plans do have the ability to say that it may not be medically necessary at that time. Okay. Now, if you do end up selecting a Medicare Advantage plan, always remember that you're still in Medicare with all the rights and protections. So it's not, some people may confuse and say, oh, I have Medicare, but I also have Blue Cross Blue Shield. So it's not, they're not separate. The Blue Cross is managing your Medicare benefits, but you still have those rights and protections. You can't be charged more than what original Medicare will charge for certain services like chemotherapy, dialysis, and skilled nursing facility care. Um, and like I mentioned, you may choose a plan that includes drug coverage. It's always important to, when you're making a decision on the type of plan that you want, always ask whether it includes your prescriptions, because you can't assume that it's going to have all of them, the prescription drug plan bundled in what it offers. And just remember, you can be charged different out-of-pocket costs and have a yearly limit on your out-of-pocket costs. And then also want to mention that to be eligible Medicare Advantage for Medicare Advantage plan, you have to have Medicare Part A and Part B. You can't only have one of them and enroll in a Medicare Advantage plan because of the fact that everything is bundled. So you have to have first enrolled in both Part A and Part B to be eligible to join the Medicare Advantage plan. These plans have different service areas, meaning that some plans are only available in the Bronx, and or some are available in Brooklyn and Queens and not in Manhattan. So they're specific to the zip code that you reside in. Um, so always when you're making decisions, always make sure that you're providing them with the area that you reside in. So to talk a little bit about the original Medicare and versus Medicare Advantage in terms of coverage. Original Medicare covers most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. Um, Original Medicare doesn't cover some benefits like eye exams, most dental care, and routine exams. A Medicare Advantage plan must cover all the medically necessary services that Original Medicare covers, but most plans will offer some extra benefits like the routine exams, vision, hearing, and dental. When you have Original Medicare, you can join a separate Part D plan, like I mentioned before. The Part C will have it bundled. Um, and in most cases for Original Medicare, you don't have to get a service or supply approved ahead of time. Whereas in a Medicare Advantage plan, like I mentioned, they have most plans are going to have prior approval. Most treatment will need prior approval, even though CMS has been working with these insurance companies to ensure that the prior approval process is as seamless as possible, and also providing guidance on which type of treatment don't require prior approvals. So, but you most likely will be subject to some type of approval process. Um, in some cases, you may have to get a service or supply approved ahead of time before the plan will cover it. So don't some when it comes to getting care, it's important to ensure that that approval is in place before you proceed with the type of treatment that you need, so that you don't get surprised with a bill because the Medicare Advantage plan ended up denying the treatment. And Nadia, I think I saw a question there.
Yes. I don't know if you want to finish this slide. It's pertaining to avoiding scams. So
Great question. Yeah.
the
I,
question
I,
is, can you talk a bit about how to avoid scams,
mhm.
especially since this is an enrollment period?
Yeah, absolutely. So I will probably hold that to the end because I think that's one that may generate some additional questions or comments. But great question. Thank you. All right. Now, I mentioned Medigap policies before. These are your supplemental plans. They're sold by private insurance companies. They fill in the gap in original Medicare, like co-payments, co-insurance, and deductibles. Each standardized Medigap policy have a number of different names after it too, which I won't share now because um, can get confusing. But if you do have any specific questions, we can always schedule a one-on-one and we can go over some of those questions. These standardized Medigap policies must offer the same basic benefit no matter who sells it. They may vary in cost. And it's important to note that you cannot have a Medicare Advantage plan and Medigap plan at the same time. So you may wonder, why would somebody consider something like that? So, Medicare Advantage plans will have some out-of-pocket costs. You may have a deductible that you have to meet. You may have a co-payment when you go to your doctor's visit. You may have to pay out of pocket for that. So the Medigap policy usually provides coverage for those types of out-of-pocket costs. But if you select a Medicare Advantage plan, you cannot be in the Medigap plan. They don't work together like that. Now, things to consider in terms of, do you want a Medicare Advantage plan? So it's important before making any decision on the plan that you select, you have to consider the cost. Medicare Advantage plans may have lower premiums, but they also will include co-pays, co-insurance, and out-of-pocket maximums impacting overall expenses. You have to consider your provider network. Most Medicare Advantage plans will have specific doctors that you're allowed to see, which and it limits the choices of the providers and hospitals you can go to. So before making any decision on a plan, you always have to remember to confirm that the doctors that you're seeing now will take this new plan that you're thinking of enrolling in, because we've seen the program has seen a number of instances where Medicare beneficiaries will see a commercial and mention and be interested in this new plan because of everything that they're offering, and make a switch, but they didn't check with their doctors, and then when they go for the next visit, they find out that the doctor doesn't accept their insurance, and now they can't see that doctor anymore, or have to try to see whether they qualify for one of those special enrollment periods. Those enrollment periods that Medicare offers throughout the year to make a change.
There's another question pertaining to
Sure.
that.
Yep.
If you switch to Medicare Advantage and later go back to Medicare, will you
Mhm.
be charged a higher premium than you paid previously?
No, no, you will not. Those are standard. So that amount that you get deducted out of your Social Security benefit will is the same amount throughout the year. They made some they usually do increase every year, a small amount, but going back and forth would not change that. The only thing that would change is whether you have to pay a premium for your Medicare Advantage or not. Okay. So things to consider when you wanted to select whether you want to select a plan, and this is usually the reason why most people select this plan. That additional benefits, your dental, your vision, your hearing, and wellness programs that are not covered under original Medicare. And then, one thing that people may not be aware, but Medicare is a national health insurance program, meaning that you can be on Medicare and receive care by a Medicare provider in California, in Colorado, any state um, in the United States. So it's not specific to where you live. A Medicare Advantage plan is specific to the state that you reside in, and most likely the borough or city, overall city that you live in. So those are things that you also want to consider, that travel and flexibility, and also whether the ease of seeing a doctor. Medicare Advantage plans usually require a referral to see a specialist. So if you don't want to deal with some of that, maybe you don't want to select a Medicare Advantage plan. Okay. So going into some of the changes for to Medicare for 2025. In this past year and in previous years, Medicare's use has had four different phases when it comes to its prescription drug coverage. You have your deductible phase, your initial coverage phase, your coverage gap, and then your catastrophic phase. So one of the most important changes in 2025 is that this coverage gap phase, which is usually referred to as the donut hole, that is being eliminated. Starting in 2025, the coverage gap phase, where beneficiaries usually had to cover a larger share of drug costs, is being eliminated. This change simplifies Part D, making drug costs more consistent throughout the year. So that is a huge win for individuals who are on Medicare and have pay a lot of out-of-pocket costs for their medications. The other thing that you'll notice here too is that the out-of-pocket threshold has been decreased significantly. You will not pay more than $2,000 in a year for your medications. Nadia, I think I saw another question there.
Yes.
Yeah.
I've heard that New York is one of the most expensive states for Medicare Advantage. Is that
Mm-hmm.
true?
That's a good question, and actually, I haven't taken a look at the premiums difference, but that's something that I would consider. It wouldn't surprise me if it is, considering that um, there's um these premiums are usually set on overall usage of the people um, that are enrolled. So it with since New York has one of higher population and more Medicare beneficiaries than other states, it wouldn't surprise me if New York actually had higher premiums than other states. Good question. I'm gonna have to do some research on that one. Okay. The other change that's coming up for 2025 is as a result of the Inflation Reduction Act, which requires all Medicare drug plans to offer the option to pay out-of-pocket drug costs in monthly payments instead of all at once at the pharmacy. This change is effective January 1st, 2025. Program participants will pay $0 to the pharmacy for covered Part D drugs if you enroll in the payment plan. Part D plan sponsors will then bill participants monthly for any cost sharing they incur while in the program. Pharmacies will be paid in full by the Part D sponsor in accordance with Part D prompt payment requirements. Enrollees with high cost sharing earlier in the calendar year are more likely to benefit from the program because the way that it works is the amount that you pay is broken up throughout the year to reach that $2,000 max that you have to pay out of pocket. So if you enroll later in the year, you're not going to get that cost saving benefit as you would if you had enrolled in January. So it's always if you are interested in this payment plan because you do take a lot of medications that you pay out of pocket for, the payment plan may be for you. For people with Medicare drug coverage eligible for extra help, also known as LIS, enrollment in extra help is more advantageous than the Medicare prescription payment plan. Okay, and this is just a slide with an example of how the payment plan will work. Due to the interest, due to time, I won't go into the specifics, but I will share these slides with an example of with the calculations of how this works for those that are interested in knowing more about the payment plan option. So now I want to talk a little bit about Medicaid. If you're not familiar, Medicaid is individuals must meet certain eligibility criteria to qualify for the Medicaid program, including residency as well as citizenship, immigration, and financial criteria. Medicaid covers inpatient and outpatient services, dental care, home health care, prescription drug coverage, and also provides long-term care. So how does Medicaid work with someone who already has Medicare? And these are dual eligibles. That's the term that is used for someone who has both coverages. All states offer a variety of Medicaid programs. Eligibility and coverage specifics vary by state, meaning that the way that you apply the benefits that are covered are not the same in Pennsylvania as they would be in New York. And here are some few examples how Medicaid can work with Medicare. Medicaid can provide secondary insurance. So for example, for someone with original Medicare, if you have that 80% that's covered and then you have to pay 20% because Medicare doesn't cover 100% of the cost, Medicaid can step in and pay for that 20%. Medicaid can also provide premium assistance, meaning that there's programs that are available through the state Medicaid program that will offset the the amount that gets taken out of your Social Security benefit. So you wouldn't have that premium cost anymore. Medicaid can also provide cost sharing assistance. Depending on your income, you may qualify for qualified Medicare beneficiary. If you're enrolled in this as a QMB, qualified Medicare beneficiary, you do not pay Medicare cost sharing, which includes your deductibles, your coinsurance, and your copays. And then more specifically in terms of care of how Medicaid works with Medicare, it can provide prescription drug assistance, and it can also offer care coordination. Some states require certain Medicaid beneficiaries to enroll in Medicaid private health plans. So those Medicare Advantage plans that I mentioned before, the special need plans, these are the ones that are specific for those that are dual eligible, and they offer optional enrollment designed to better coordinate Medicare and Medicaid benefits. I will add that New York State is really pushing for dual eligibles to enroll in these S&P plans, these special needs plans, because of the overall better coordination. So as opposed to having two agencies that don't necessarily speak to each other and to manage someone's care, if you're in one of these S&P plans, you'll have a care coordinator that's that's monitoring your overall care, and then the costs of those services are being managed by just one entity. So to find out more, you can call 1-800-Medicare or contact your local Medicaid office to find out if you're eligible. And these are some information on the income limits. Again, the slides will be shared, and you can see whether you qualify or not. There's Medicaid has different tiers of eligibility. So you would be looking at the individuals who are age 65 or older. It's a different tier.
There's a question about
Sure.
Medicare Advantage.
Yeah.
Do most people have Medicare Advantage now, even though it limits doctors you can see and makes you get referrals?
Yes,
Seems like a
great question.
disparity.
Yes, as of the summer of this year, over 50% of Medicare beneficiaries are enrolled in, and this is the United States, are enrolled in a Medicare Advantage plan. This has been an upward trend to Medicare Advantage over the last 10 years. It used to be a very disproportionate between original Medicare and Medicare Advantage, but over the last 10 years, Medicare Advantage has been creeping up to the point where this past year, more people have Medicare Advantage than original Medicare. And the reason for that is for those additional benefits that I mentioned. Vision, very important to keep up with the ability to get your glasses paid for once a year, or once every couple of years, I believe. Dental care, which it's a travesty that original Medicare does not cover this. And CMS is looking into the possibilities of that changing in upcoming years, but as of right now, only Medicare Advantage plans offer this. And then also for those that are dual eligible, there is what's called an OTC, an over-the-counter card, which is a monthly stipend or sometimes a quarterly stipend that the healthcare plan, these Medicare Advantage plans offer for and their members, which allow individuals to make purchases at your Walgreens, at the supermarket. You can buy food. You can also pay for your utilities. So obviously, for individuals, especially those with low income, these Medicare Advantage plans are just that they're very advantageous to their finances, to their overall care for the coordination, but ultimately it's those additional benefits that really drive someone to make a decision to select a Medicare Advantage plan. Okay, now for people who do need help because they have limited income or resources, Medicare, there are programs to assist, such as the Medicare Savings Program, Medicaid overall, which we talked about, and then Extra Help. Medicare Savings Program, these are state-run programs that can help cover Medicare expenses. These are what I mentioned earlier about the qualified Medicare beneficiaries, your QMBs. There's also the Extra Help for low income. It's a low income subsidy, which helps reduce prescription drug costs for people with limited income. And then the next slide is just some information on how to qualify for Medicare Savings Program, which I won't go into details again due to time. I do want to have at least some time for some questions, but these slides will be shared. Talk a little bit about Medicaid managed long-term care. Medicaid provides community-based long-term care services. To qualify for long-term care services, individuals must be Medicaid eligible and need assistance with activities of daily livings or continuous care supervision due to a chronic illness or disabilities. These services include certified home health services, personal care assistance, private duty nursing services, skilled nursing services, and Consumer Directed Personal Assistance Program, your CDPAP. This is a program where a family member or friend can serve as your home attendant, and then the Medicaid program will provide will pay that individual as opposed to having someone, a home attendant that you don't know. If you have Medicaid and you want to apply for long-term care, you can call New York Medicaid Choice at 855-222-8350 or visit their website, and they will start the process to perform a series of evaluations to determine whether you qualify for home care and the amount of hours you're eligible for. So again, a lot of information covered, but wanted to recap and just go over some of the things that we discussed. Medicare is a health insurance program for individuals over the age of 65 or those that are disabled under Social Security disability. Decisions affect the type of coverage you get. So if you don't enroll at a certain time, then you may not have that coverage for the upcoming year. So it's always important to keep on top of the deadlines. Medicare doesn't cover all your health care costs. So it's always important to understand what your costs are and how you're going to pay for them, or whether you need a Medigap or Medicare Advantage, or if you're eligible, apply for Medicaid. Certain decisions are time sensitive. So if you miss that deadline, you may not get another opportunity until later in the year. You have choices in how you get your coverage. So it's always important to review your healthcare needs because there are a lot of options out there. And there are programs for people with limited income and resources. And speaking of those resources, these are 4 resources that I thought would be the best to share. Our Health Insurance Information Counseling and Assistance Program, HICAP, which is a program that all states offer. It's free, unbiased information on Medicare and related health insurance. It's managed by the New York Department of Aging. There's also the Medicare Rights Center, which provides assistance for navigating Medicare, resolving coverage denials, and understanding benefits. The Social Security Administration, which assists with Medicare enrollment and answer questions about Social Security. And if you didn't know this already, your public libraries do also have Medicare information sessions like this one, particularly around open enrollment. They offer free workshops, Medicare guides, and access to knowledgeable staff for additional assistance. And the number to call for all your Medicare questions is 1-800-Medicare, which is 1-800-633-4227, and I'll share that information as well. Now, for individuals who are interested in being seen at hospital for special surgery and have questions related to their Medicare or Medicare and Medicaid coverage, or even Medicaid, because the hospital does participate with Medicaid as well, you can contact our program line at 212-774-2011, or you can email us at voicesmedicaideducation@hss.edu. And I forgot to mention this earlier, but Nadia will be sharing a survey. Hope everyone can fill out the survey, provide us with feedback on how I did. And like I said earlier, this was a general overview. But if you have specific questions, we can always schedule a one-on-one. Or if you feel that for future, if there's an opportunity for future presentations and you want more specific information, the survey is a good place for that. Now, to answer that question earlier about how to avoid scams, I think as with anything related to your personal information, just be very secure with who you provide your Social Security number to, who you provide your Medicare ID number to. There's a lot of scams going on, phone scams, and now with AI, you have individuals that are that are using predatory practices to try to steal someone's information or scam them into sending payment for something that they don't have to pay for. So when it comes to Medicare, always know that you don't have to make a decision right then and there. These individuals will, even your sales broker, um, will use tactics, which I always equate to like a car salesman. They'll try to push you to make that deal, to make that sale. You can always say no. You can always walk away from it, and don't feel pressured into making a decision. And if you are working with someone, make sure that they showed you proper identification. Who are they working with? They should have licenses that they have to qualify for, that determine just how that determine whether there are legit broker or not. So those are some ways that you can try to prevent scam. And then most importantly, over the phone, always make sure you know who you're talking to. Don't share information. Again, with AI, it's so easy to um, fake someone's voice, or even on a video call, fake the image that you see on the call. So always try not to share any information over the phone if you don't know who that person is. And that's the end of my presentation. Thank you for attending. Thank you for listening. And again, thank you for this opportunity. I really appreciate it.
Well, thank you very much, Randy. That was really informative. I see a few people are giving you well-deserved thanks there. That was excellent. We will post this at some point on our YouTube page. And I believe you're going to send me these. Well, I have the slides. I'll send those out to the registrants so that they can see those and look at those at their leisure. Please do click on the link that Nadia put in the chat there for a survey. And actually, we can also put that in the email that we send out. So that will help you guys. And as you mentioned, there are other topics you might be able to give. So hopefully I'll get some feedback from PSS members, at least in terms of something they might be interested in. So
Excellent.
thank
Thank you.
you.
Thank you.
Thank you,
Take care,
everybody, for
everyone.
attending. Please take a look at our events page for future events, and we really appreciate your support. Take care, everyone. Bye-bye.
Thank you,
Thank
everyone.
you.
Bye.
Bye.